Welcome to Autism Approved, brought to you by Enzymedica. Now, here's your host, Kristen Selby-Gonzalez.
Hi, and welcome to Autism Approved. I'm your host, Kristen Selby-Gonzalez. Right now, we are currently in Tampa, Florida, where we are interviewing people at the National Autism Association Conference. If you've missed this conference or you want more details about this conference, please visit them on their website at www.nationalautismassociation.org. Right now, I have the great pleasure of talking to one of the presenters here, Dr. Jeffrey Becker. Glad for you to be here. Still kind of early in the morning.
Nice meeting you. It's early.
So, I am super excited about talking about what your specialty is, because what you do, there's not a lot of doctors that I know do it.
That's true.
Mm-hmm. And so, do you want to talk a little bit about the optometry work that you are doing with children with autism?
Basically, we have a site in Pennsylvania, the Keystone Neurosensory Centers, and we see children and adults with neurosensory disorders, and over 50% of our practice is dealing with autism. And we evaluate and treat children with autism that have neurosensory disorders, visual disorders, and vestibular disorders. I'm also a DAN clinician in training. I've been trained in the DAN protocol, so we also work with their biomedical care, and we have several nurses on staff who are trained also in that area. So we're pretty much an all-inclusive facility. We do focus on the visual abilities. These children have significant visual deficits, and we also work with their DAN doctors, or we do our own DAN treatment and protocols.
Now, what inspired you to get involved?
Well, I'll tell you, I've been involved in rehab since 1986.
Wow.
For a long time. And in 2001, I pretty much sold my practice, my primary care practice, and did some consulting. And I've always noticed when I'm dealing with people with neurosensory disorders and children with autism, because I like to put them together because they typically have neurosensory disorders, we weren't seeing the results we were. So through those years, we developed techniques and did some clinical data, and we found out that we do certain things, these kids get better, okay? They seem to get recovery, they seem to improve eye focus and eye contact, and they improve overall general functioning. So it's such a great thing to see these parents come back and say, oh, my kid's doing this, my kid's doing that, he never did it before.
Yeah.
And we get notes from the teacher saying how much better they are, or a teacher would say, what are you doing to your kid? He wasn't like this before, he's so much better. You know, so when we have that, and that's so gratifying to myself and my staff, because, you know, these kids need our care, and if they don't get this care, they're not going to recover, and there'll be a problem for the rest of their lives with the caretakers. And we want these kids to recover so they can be productive in our community, and that's what we're there for. And it's very gratifying, because we only see 8 to 10 patients a day. That's it, and we spend a lot of time with these patients, and the patients appreciate it. We're usually told that no doctor's ever spent so much time with them before, and our nurses, and they need a lot of time. But it's very gratifying. It's gratifying to see the kids doing better. It's gratifying to see how the parents are happy about it, and their caregivers. And it's great getting notes from their teachers and the counselors and the ABA therapists and so forth.
Well, you're the voice for them in a lot of ways, because a lot of our children, before we started, I was telling you that I have a little boy who's on the spectrum, and, before he had language, basically his doctors, his therapists, and myself were his voice, because we have to try to figure out why they're doing the things that they're doing. And one of the things that we were talking before we started, I love the fact that you're looking at it as why are they doing it, and not trying to stomp out that behavior.
Yeah, we're trying to figure out why they're doing it, find out what the cause is.
Yes.
And once we can find the cause, then we can treat the cause.
Because they're doing it for a reason.
They're doing it for a reason. And can I show you something here?
Absolutely.
Okay. I have glasses here that I use in my demonstrations. And I don't want you to say anything. I want you just to put them on, okay? And when you put them on, you'll see that the distortions are really bad. But if you close one eye, things are fine, right?
Oh, yeah.
And if you close another eye, things are fine.
Wow.
Right? So when kids start visual stimming, you'll start seeing that they start turning their heads like this.
Because they want to see
better.
Yes, because it's clearer.
Exactly. Or they want to turn their heads this way, and it's clearer, okay?
Because it makes you nauseous when you first look.
So if you're doing therapy and tell them to hold their head straight, they're starting to get very nauseous.
Yes.
Another thing they do is they start to visually stim. If you do that, you'll see
It
that
balances
it balances out, makes it better.
Oh, wow.
So if we can figure out why these kids are doing that, and we pretty much know why they're doing it, and correct that condition, that goes away, so we stop seeing the visual stimming. But a lot of times, we'll like, in the teachers and the autism clinics and education, we'll say, oh, keep your head straight, or the therapist will say, keep your head straight, or put your hands down, stop doing the stimming. But they're doing these for reasons, and they're doing it because it helps them. Okay,
Wow.
Isn't it weird?
Yeah, because it gives you, for the viewers out there, it gives you this nauseous kind of feeling.
Sure.
But if you were to churn, it actually balances each way, and I can absolutely see why somebody would try to take away the stimulation in the front here. They're trying to balance it.
And I'm not going to put you on the floor, but if you were to roll on the floor and put your head down, it would be better too.
Wow.
And a lot of times you see these kids do a lot of rolling on the floor and trying to do that. And being a DAN clinician, when we have these kind of problems with visual stimming, we have to look at the yeast factor in those areas. But if they're fine and there's not a yeast problem, we've got to look at what's causing the visual stimming. Is it a visual processing problem where the nerves going to the brain aren't functioning properly? These glasses quickly demonstrated to you what it's like.
Absolutely.
Now, if you're a child with autism, you can't say to me, oh, Dr. Becker, I think my visual system is off, you need to treat it. They do things like moving their head back and forth, covering their eye, visual stim. And if it's not corrected, they start to get aggressive. The behavior changes. They have really good days and really bad days. And nobody can figure out what's going on. So some physicians, treat them with pharmaceuticals, medications, which we're not agreeable with.
Because then they just kind of numb them at that point,
It
right?
numbs them. It's just treating
Yeah.
symptoms. And those drugs, those pharmaceuticals, are really just symptom relievers and symptom changers, and they produce more symptoms. So they're not really doing anything. So we got to find out what the cause is. And we can find out what's causing the visual stimming and the visual the neglect and the visual lack of contact, and we can improve it through therapy, glasses, prisms, and so forth. We find out these kids get better.
So are we looking for the symptoms then of the child? If you have it, if like the viewers that are watching, for the children that are maybe doing the fingers or looking sideways. I know my son used to do that, and we've done a lot. I mean, I wish I would have known about you back then, but we did a lot of things with diets, and I remember him taking a puzzle piece and going back and forth,
But when you put his glasses on, you find out it's easier to look at it that way.
Yes, absolutely.
And if you're an untrained therapist, you would say, oh, Johnny, put it back in the middle. And then you're forcing him to put it back in the middle, yet he wants to keep looking at the side. You're forcing him to put it back in the middle. As a person with autism, they're going to get aggressive because they can't tell you why it's so frustrating to do that. So if you can't speak auditory like we are speaking, what's your next thing you're going to do? You're
Absolutely.
going to act out physically. You become a behavior issue. You become frustrated. You might be hitting or
Well, because they're
whatever.
going in fight or flight mode at that moment because
You're
they're
exactly
trying
right.
they're trying to take care
Yes.
of themselves. And I'm thinking if somebody did that to me and I'm trying to make myself feel better and they kept making me stop, what's our first defense? We are going to attack. Absolutely.
Try to get rid of it, because it's a natural inborn instinct we all have. And you see it. You'll see good days and bad days, and a lot of therapists say, oh, he's a behavior problem, he's not cooperating. Find out what the cause is and treat the cause. Don't treat the symptoms.
And I love that because that's with our son. We've been doing that from basically after 2 weeks after the diagnosis. I remember we had therapists come in and they said, no, he needs to sit still. Oh, time starts over. Oh, time starts over. And it never made sense to me as his mom. I wanted to figure out, well, why is he doing that? Why is he so fidgety? Sensory integration has been huge, with us. And I think it's, for all the viewers out there, and if you're a parent, if you're a grandparent, an aunt, an uncle, I think it's important to realize that our kids aren't trying to be bad. They really are trying to take care of themselves. And I love that you do the detective work.
And it is a detective work. We have a good team of diagnosticians and therapists and nurses and psychologists and myself that look at these kids. I guess what's really important is to treating the cause and not the symptoms. And we actually have a lot of therapists that are trained. We train a lot of occupational therapists, trained how to treat these problems correctly, with vestibular therapy, with visual motor, visual integration, and computer games and so forth that actually help get rid of these symptoms, causing the child to improve learning, improve eye focus, improve a behavior. And we were working with a local institution, outpatient institution, that has 70 of our kids, over 70 of them actually, in the autism doing therapy. And some of the therapists said, I wish I'd known this 4 years ago. Some of these kids don't even belong in this anymore because they look like they're coming off the spectrum. That's how wonderful it is on some of these kids.
Wow.
And it really makes a big difference.
Well, now, for those that, are looking at, is it a visual issue? Like, is it something that can be corrected this way? Is it just a typical, do they just need glasses? How do we know the difference between what is just somebody who needs glasses or an actual processing issue?
Typically, typically these kids, it's not a glasses issue. It's not how well they see an object at a distance. Typically, it's how the brain interprets the images. So when you put these glasses on, each eye individually saw fine, but when the brain was putting the images together, it couldn't do it. It created confusion on your part, and you started to do things to get rid of that confusion. So it's not really a glasses issue. We have to do an evaluation to find out what information is going back to the brain, how the brain's interpreting it. If we can do that, and we do that through electrodiagnostic testing, we can then determine this is the treatment protocol you have to do for that particular problem.
Now, what does a screening typically look like?
And our screening?
Yeah, when you're screening a child to figure out if this is standard vision problem or...
Well, in our